The ideal duration for rhinoplasty surgery is approximately between 2 hours and 15 minutes to 2.5 hours. However, the most important point to understand here is that the time the patient spends away from their room is much longer than this figure. The reason for this is that after leaving their room, first we take the patient to the preoperative evaluation room where they are kept before the surgery. Here, various pre-medication drugs are administered and blood pressure is managed. After the patient is taken to the operating room, contrary to what is commonly believed, the surgery does not start immediately. Once the patient is on the operating table, anesthesia is administered to sedate them. Then, to prevent the patient from getting cold during the surgery, heaters are connected to them. And then a local anesthetic agent is applied to the patient's nose. Then we cover the patient, and the patient's face is cleaned with sterile solutions. After that, the surgery begins. After the surgery lasts 2 hours and 20 minutes to 2.5 hours, the patient's recovery process begins. I try not to send any of my patients back to their room until they are fully awake. I wait for the time needed for the patient to recognize me and talk to me in the recovery room. In other words, the time the patient spends away from their room can sometimes reach 4 hours and at other times 5 hours.